Buprenorphine is a medication that has been approved by the FDA for the treatment of opioid addiction. It is a partial opioid agonist, which means that it works by binding to the same receptors in the brain as other opioids, but it produces less euphoria and has a lower risk of overdose. Despite its proven efficacy in treating opioid addiction, there are still many myths and misconceptions surrounding buprenorphine. In this video, we will be separating fact from fiction and exploring some of the most common myths surrounding this medication. Understanding buprenorphine. Buprenorphine is a medication that is used to treat opioid addiction. It is available in several different formulations, including sublingual tablets and films, as well as an injectable form. Buprenorphine works by binding to the same receptors in the brain as other opioids, but it produces less euphoria and has a lower risk of overdose. This makes it an effective medication for the treatment of opioid addiction. Myth number 1. Buprenorphine is just a substitute addiction. One of the most common myths about buprenorphine is that it is just a substitute addiction. This myth suggests that buprenorphine is just another opioid and that people who take it are simply substituting one addiction for another. However, this is not true. Buprenorphine is a medication that is used to treat opioid addiction, and it is not the same as other opioids. Buprenorphine produces less euphoria and has a lower risk of overdose than other opioids, making it an effective medication for the treatment of opioid addiction. Buprenorphine is also used as part of medication-assisted treatment (MAT) programs, which combine medication with counseling and behavioral therapies. MAT programs have been shown to be highly effective in treating opioid addiction, and they have been endorsed by organizations such as the World Health Organization, WHO, the National Institute on Drug Abuse, NIDA, and the Substance Abuse and Mental Health Services Administration, SAMHSA. Myth number 2. Buprenorphine is too addictive. Another common myth about buprenorphine is that it is too addictive. This myth suggests that people who take buprenorphine are at risk of becoming addicted to the medication itself. However, this is not true. Buprenorphine is less addictive than other opioids, and it has a lower risk of overdose. In fact, buprenorphine is often used to help people taper off other opioids and to prevent withdrawal symptoms. Buprenorphine is also available in several different formulations, including sublingual tablets and films, as well as an injectable form. This allows healthcare providers to customize the dose and delivery method to meet the needs of each individual patient. Additionally, buprenorphine is typically administered under the supervision of a healthcare provider, which helps to minimize the risk of misuse or diversion. Myth number 3. Buprenorphine is only for severe cases of addiction. Some people believe that buprenorphine is only for severe cases of addiction, and that people who are not severely addicted to opioids do not need this medication. However, this is not true. Buprenorphine can be used for both short-term and long-term treatment of opioid addiction, and it can be effective for people who are struggling with mild to moderate opioid addiction. In fact, the American Society of Addiction Medicine, ASAM, recommends that MAT with buprenorphine be considered as a first-line treatment option for people with moderate to severe opioid use disorder. Additionally, the WHO recommends the use of MAT for the treatment of opioid dependence, regardless of the severity of the addiction. Myth number 4. Buprenorphine is expensive. Another common myth about buprenorphine is that it is expensive and not accessible to everyone. However, this is not true. Buprenorphine is covered by most insurance plans, including Medicaid and Medicare. Additionally, there are programs available to help people who do not have insurance or who cannot afford the medication. For example, the Substance Abuse and Mental Health Services Administration, SAMHSA, has a prescription drug assistance program that helps people access medications for the treatment of opioid addiction, including buprenorphine. Additionally, many healthcare providers offer a sliding scale fee for people who cannot afford the medication. Fact number 1. Buprenorphine is an effective treatment for opioid addiction. One of the most important facts about buprenorphine is that it is an effective treatment for opioid addiction. Buprenorphine has been shown to reduce opioid use, improve treatment retention, and reduce the risk of overdose. Additionally, buprenorphine has been shown to be more effective than other medications for the treatment of opioid addiction, such as methadone. Buprenorphine is also effective for people who are struggling with chronic pain and opioid addiction. In fact, buprenorphine is often used to treat chronic pain in people who are also struggling with opioid addiction. as it can help to reduce the risk of misuse and diversion. Fact number 2. Buprenorphine is less addictive than other opioids. Another important fact about buprenorphine is that it is less addictive than other opioids. Buprenorphine produces less euphoria and has a lower risk of overdose than other opioids. Additionally, buprenorphine has a ceiling effect, which means that it does not produce increasing levels of euphoria or respiratory depression with higher doses. This makes it a safer medication for the treatment of opioid addiction. Fact number 3. Buprenorphine can be used for both short-term and long-term treatment. Buprenorphine can be used for both short-term and long-term treatment of opioid addiction. Short-term treatment with buprenorphine can help people manage withdrawal symptoms and reduce their risk of relapse, while long-term treatment can help people maintain their recovery and reduce their risk of overdose. Additionally, buprenorphine can be used as part of medication-assisted treatment (MAT) programs, which combine medication with counseling and behavioral therapies. MAT programs have been shown to be highly effective in treating opioid addiction, and they can be tailored to meet the needs of each individual patient. Fact number 4. Buprenorphine is covered by most insurance plans. Finally, it is important to note that buprenorphine is covered by most insurance plans, including Medicaid and Medicare. Additionally, there are programs available to help people who cannot afford the medication. This means that buprenorphine is accessible to most people who need it, regardless of their financial situation. Conclusion. In conclusion, buprenorphine is an effective medication for the treatment of opioid addiction. Despite the myths and misconceptions surrounding this medication, the evidence suggests that buprenorphine is less addictive than other opioids, can be used for both short-term and long-term treatment, and is covered by most insurance plans. If you or a loved one is struggling with opioid addiction, it is important to speak with a healthcare provider to determine whether buprenorphine is the right treatment option. Together, we can bust the myths and provide evidence-based information to help people make informed decisions about their healthcare. Thanks for watching.